Lymph node examination, how to perform. I am Dr. Piyush Somani, working in NMC Hospital, Sharjah and Dubai. There are no disclosure to make. So our objectives of the present presentation is, what are normal mediastinal lymph nodes? What are the B mode features of pathological lymph nodes? Color, power Doppler mode of pathological lymph nodes, elastography, strain ratio and histogram. Before we start or before we discuss how we should do evaluation of lymph node on EUS or on EBUS, we should first know what are normal lymph nodes. So normal mediastinal lymph node detection is important. We should know how many lymph nodes are normal at which location in the body, whether in mediastinum or in abdomen. So this is an important paper, 2013, showing us the normal location of lymph nodes in different region as per the ISLC classification. As we can see, subcarinal region is the commonest region where 100% lymph node are present normally in normal people. Right lower paratracheal, left lower paratracheal, station 8, station 9, lymph nodes are also there. So this is the presence of lymph node in 4R, 4L, 7 region. This is the longest diameter. As we can see, the diameter varies from 6 to 30 millimeter. And this is the number of lymph nodes normally present. So we can see in subcarinal area, the normal lymph nodes can be up to 4. This is an image showing the number of lymph nodes in different location. Most common obviously is the subcarinal area. What are the features we should look for in the lymph node? So when we see a lymph node, the first thing is look at the size of the lymph node. So we have to measure the long axis, short axis. Second is, what is the shape of the lymph node? Very important. Is it irregular shape? Is it tongue shape? Is it stretched? Is it oval or round? So anything which is oval or round is important. What is round shape? There is no fixed definition to it, but usually in the studies it is described ratio of long and small axis being less than 1.5, indicating overall round shape. Margin, very important. Is it indistinct or distinct? A well-defined margin is defined as more than 50% of the echogenic line delimiting the lymph node. Echogenicity, is it homogeneous? Is it heterogeneous? Heterogeneous echogenicity means presence of non-uniform echogenic patterns. Please look for central hilar structure, basically which means flat central avascular echogenic structure in the lymph node. If it is present or not. We need to look for coagulation necrosis sign, which is hypoechoic or anechoic area within the lymph node with absence of blood flow on Doppler. Matting, conglomeration, is it present or not? The lymph nodes are matted when lymph nodes are in confluence and no normal soft tissues intervene between them. Is there a calcification? Yes or no? And what are the different vascular patterns? So these are the 9 features we should look at the lymph node. Now this is important study showing in normal subject when EUS was performed for non-mediastinal indication, 75 patient that comes to 72% have lymph nodes. Most common location was station 7 or 4L, was more common in the smokers. Now when we see a lymph node like this on EUS, as we can see, this lymph node is not round, it's not oval, it is elongated. The short axis, long axis is more than 1.5. There is a central hyperechoic hilar structure. It's not well defined, which basically indicates that this hilar lymph node in the liver hilum is non-pathological. Here you can see another lymph node, which is again not defined, as 50% cannot be seen. It is hyperechoic with central hyperechogenicity. Similarly, another lymph node is present with some calcification. We can have calcification in a normal lymph node. This is not looking pathological because it's not round, it's not heterogeneous, it's not hypoechoic. It favors a benign pathology. What are the features of malignant lymph nodes? Hypoechoic echotexture, distinct margin, round, diameter more than 1 centimeter. If we have these 4 features, there's 100% accuracy that this is a malignant lymph node. But not always these 4 features are present. It is present only in 25% cases. Besides this feature, We should look for absence of hyperechoic lymph node hilum, lack of central nodal vessel, coagulation necrosis sign, and heterogeneous echo pattern. These are other features of malignant lymph nodes. Why there is round shape? Why round shape is important? When there is a malignancy in the lymph node, there is increased density of tumor cells and vascular structure within the lymph node, and soon after expands the shape and size of the lymph node. The central hilar structure is the lymphatic sinus within the lymph node. When cancer cell infiltrate the sinus, the hilum will become blood. Malignant lymph nodes don't have visible hilum. This is because of infiltration or push of the tumor tissues or necrotic tissue. Matting, conglomeration is a sign of malignancy or tuberculosis. This is the different images on EBUS of a normal lymph node with central hilar structure, as you can see here. Central hyperechoic white hyperstructure. This is a round hypoechoic lymph node. It's heterogeneous, which favors a pathological origin. Coming to different vascular patterns of lymph node, it could be avascular, no vascular signal. It could be hilar signal, non-hilar. Hilar basically means flow of signals from the hilus. Non-hilar means central, capsular, or mixed. If you look at these different patterns are there, it's very important. So this is avascular. This is hilar vascular pattern, which is normal pattern in benign lymph node. This is the non-hilar pattern. It could be capsular in the periphery. This is non-hilar central, and this is mixed. If we see non-hilar, central, peripheral, or mixed, it favors metastatic lymph nodes because benign lymph node have hilar vascular pattern. So summarizing everything, the different features, the size, the shape, the margin, the central hilar structure, echogenicity, is it homogeneous, is it heterogeneous, is the necrosis sign present, absent, is there a matting, is there a calcification. This is one of the score used for malignancy known as Canada lymph node score. Again, margin, central hilar structure, and the size. If you have more than 2 score, high chance of malignancy. These are the sonographic features of malignancy. This lymph node has all the features: heterogeneous, central hilar structure, central necrosis, well-defined margin, round shape, more than 1 centimeter. This is an old study 2001, which is important to differentiate benign versus malignant. Size more than 1 centimeter or within 1 centimeter of the tumor indicates high chances of malignancy. So this is a visual analog scale for the assessment of lymph node. This is another study showing the power color Doppler image characteristic of lymph node. There are different grades in this study: grade 0, grade 1, grade 2, grade 3, grade 4, or BA sign. Grade 0, there is no blood flow. Grade 1, it's like an hilar structure. Grade 2, few rod-shaped flow signals. Grade 3, more than 4 vessels with different diameters. And BA inflow, blood flow from the bronchial artery towards the lymph node. Grade 3, grade 4 are suggestive of malignancy. Now coming to tuberculosis, we see regularly tuberculosis in country like India, particularly with Asian population. So what are features of tuberculosis lymph node? Fusion of lymph node, presence of hypoechoic areas due to necrosis, indistinct margin, heterogeneous ecotexture, calcification, cacheation, and abscess formation. These are different EUS images of lymph nodes with different features of tuberculosis: round lymph node, heterogeneous, central necrosis area, sometimes air pockets, abscess formation, loss of septation, conglomeration, as you can see here. What are the features of sarcoidosis lymph node? Distinct margin, as we can see here, no cacheation, granular sandpaper appearance, and homogeneous. They are not heterogeneous like a tuberculosis lymph node. How to differentiate TB versus sarcoid? Heterogeneous ecotexture, central necrosis. On EBUS or EUS favors TB over sarcoidosis. The positive predictive value is around 91% when any of these two findings are present if we combine with tuberculin skin test. So this is an important study by Dhuria et al. showing sarcoid versus TB. Most important feature of sarcoid is homogeneous, TB 53% heterogeneous, coagulation necrosis sign present in TB and absent in sarcoidosis. So these are the features. This is a typical coagulation necrosis sign in abdominal lymph node. You can see the necrosis here and you can see the lymph node here. Now coming to elastography. Elastography is imaging equivalent of the ancient palpation and it is a real-time method for evaluation of tissue stiffness. Simple principle is softer tissue deform easily, harder tissues are difficult to deform. Two types, qualitative, quantitative. Qualitative elasticity is 1 to 255 in the form of color map, red, green, blue. Hard tissue is dark blue, intermediate is green, soft tissue is yellow, and soft tissue is red. Two methods for qualitative, strain ratio, strain histogram. Strain ratio is very important. Two areas are selected. So which are these two areas? So area A, area B is there. Area A is usually the representative of the pathological part. Area B is the normal area in the lymph node or any solid mass. You look at the ratio, higher the ratio, more chances of malignancy or hard tissue. You can see another area A, area B, you can see the area or the ratio which is there. So different areas, different regions are there. For strain histogram, largest measurement box that touches the inside boundary of the lesion is selected. X-axis indicates elasticity. This helps us analyze the distribution of strain within the large area of interest. It shows key parameters. So if you look at this lymph node here, this is the lymph node, this is the EBS scope, this is the US scope in the same patient. You see a graph here, and this graph tells us how much percentage is the hardest part in this area, the mean deviation, and the softest part. There is an advantage of EUS over EBS because of the large size transducer. It gives better assessment as compared to the EBS. US elastography is very useful with sensitivity of 88%, specificity of 85%. Benign lymph nodes are homogeneous, soft pattern, green or red, yellow, green. Malignant lymph nodes are predominantly blue. It may help us in identifying which lymph nodes to select for the biopsy FNAC or the hardest area within the lymph node. So it definitely helps us in reducing the false negative result. However, the technique of elastography is more standardized in EUS as compared to EBUS because it was available before the EBUS. There is a limited advantage of elastography in EBUS. Few studies are coming up in the last few years. The reasons for its disadvantage of elastography in EBUS is recent introduction, better transducer in EUS, and wider field of vision, and lack of studies. So at this moment, the role of EBUS elastography appears to be limited. However, further studies are coming. I thank you all for your time and patience. Thank you.